This is from the WHO, and this is untrue. Okay. Conveyed to the WHO by Chinese authorities 11th to 12th of January. Anyway, it says no additional cases have been detected since 3rd of January. Symptom onset of the 41 cases ranges from 8th of December to 2nd of January. Okay, so no additional cases have been detected since 3rd of January. Blah 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 blah. And then it says no case has been reported elsewhere other than Wuhan, although it does say the novel coronavirus specifically, but that's misdirection, because there were already people with unknown pneumonia in Shenzen. Right, we'll have a look at that in a minute. So no cases reported else other than Wuhan, that's not true. And no additional cases detected since January the 3rd is not true, because if you look at this paper here, right, which is a very good paper, Clinical Biochemical Indexes in Science China Life Sciences, published in March, volume 63, number 3, pages 364 to 374. Look at page 366. There's a very good, very clear diagram on page 366. Okay, and that diagram shows a bunch of people. 1, 2, this is symptoms onset. Okay, symptoms onset there, purple arrow, between January the 3rd and January the 11th. 1, 2, 3, 4, 5, 6, 7, and I think these are January the 4th, 8, 9, that one's afterwards, 10. So there's maybe up to 9. I thought there was 7, but there's actually 9 people who had, 2 of them had pneumonia. Okay, I don't know whether the others had pneumonia. Some of them had ARDS afterwards. But basically, okay, if you go and take some screenshots, 12 patients with pneumonia of unknown cause were admitted to Shenzhen 3rd People's Hospital in Shenzhen between January the 11th and January the 20th, and were confirmed to be infected with 2019 COVID. 3 patients were in a critical condition and 5 were severe. Well, you can see that some of them developed ARDS, which is the ARDS, which is the blue arrow, those there. Okay, and these had just diagnosed pneumonia. And some of them were discharged. I don't know if they were all discharged. Those were discharged. I don't know what happened to the others. One was a 10-year-old man. That's a very young man. Case number 7. Anyway, whatever. Should say, it could say male. I mean, it's just part of the translation. But it's very, very interesting. Okay, look, the incubation period up to 13 days. Okay, estimated. Okay. And this is whether they got it via local transmission, or maybe they stayed in a hotel, or maybe they were travelling and stuff like that. And this is when they were in hospital. Okay, but that's very interesting. 2 of them were in hospital by January the 11th. These 2 here. Okay. Ding. Okay, let's have a look at another bit. We found that viral load was crucial in determining the disease severity. High viral load lasted for 1 week, and it was very high when fulminant myocarditis also occurred. Yuck, that sounds very nasty. Inflammation of the heart muscle. Right, discussion. We report 12 cases with laboratory confirmed COVID-19 infections. All patients were admitted to Shenzhen 3rd People's Hospital. All patients were either travelling to Wuhan or from late December to early January, except case 5. 2 family clusters. But that's not really the point, is it? The point is that these people were seen to have symptoms, or were asked, maybe they were admitted on the 11th or later, and they said, oh, we had symptoms since day X. But the point is that there are 2 people here on January 11th with pneumonia of unknown cause, and 2 others who were admitted to hospital. So these 2 people weren't admitted to hospital yet, they were admitted a bit later. But these people were already admitted by January the 11th, and they all had symptoms start, apart from one of them, before January the 12th, between the dates of these WHO reports. So the WHO was really misleading people here. No additional cases have been detected. I mean, that's like, it doesn't say confirmed case, it doesn't say anything, okay? Chinese authorities identified a new type of coronavirus, okay? So basically, essentially, they're looking at confirmed cases, but they must have known that these other people, they were investigating these other people at the time. They were in hospital, or they were on their way to hospital. Before this report, some of them, they were diagnosed, at least clinically, before this report. It says no new cases. Okay. And no cases have been reported elsewhere other than Wuhan. But this is in Shenzen, which is nowhere near Wuhan. Okay, that's in the mega city, maybe in Shenzhen or whatever, or yeah, whatever, you know, Guangzhou or somewhere. But you know, that's outrageous, really. That's an outrageous untruth that the WHO has put there. And of course, according to that, okay, then they say novel coronavirus apply, advises against the application of any travel or trade restrictions on China based on the information currently available. Okay, this just shows how much they're in the pocket of China. Okay, really does. I mean, it's astounding to see 5th of January pneumonia of unknown cause, and then of course Thailand 14th of January. Okay, Japan 16th and 17th of January, Korea 21st of January, and I think also Taiwan reported a case on the 13th. They probably didn't mention it here because they're not in the WHO. But I mean, it's kind of outrageous, really. Pneumonia of unknown cause. Now, I don't know if it says anything about novel coronavirus on the 5th of January. They probably didn't know. Infection prevention and control, that would be interesting to look at that. 44 cases of pneumonia requiring hospitalisation clustered in space and time should be handled prudently. Wuhan city with a population of 19 million, capital Hubei with a population of 58 million. Requested further information on tests performed and differential diagnoses considered. Well, that's fair enough for them. But the 12th of January, we've got all this other stuff. No cases been detected since the 3rd. Okay, what about the 5th of January? Cases of pneumonia of unknown etiology. Pathogen identification, so they haven't fully done it then. Risk assessment. Doesn't really say. Doesn't really say. Except they advise against the application of any trade or travel restrictions on China. On the 5th of January. What about a little bit later? Let's have a look at the one about Thailand. Or the Korea one. Let's have a look at the Thailand one, shall we? See what they said on Thailand. See what they said on Korea. And see what they said on Japan. Okay, then you got... oh, there's some Ebola stuff as well. Okay, but we're not dealing with that right now. Okay, KKK. We've seen that one already. We've seen that one already, I think. Thailand ex-China. So it's gone to another country. As the traveller didn't report having visited the market, blah, 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 blah. They advise against the application of any travel or trade restrictions on the, whatever date that was, 14th of January. Okay, let's have a look. 21st of January. And here we are, Republic of Korea. Who advises against the application of any travel or trade restrictions on Korea? Okay, what about China though? Does not recommend any specific health measures for travellers. Encouraged to seek medical attention, da-di-da-di-da-di-da-di-da. Now on a previous one they said no health measures for travellers like temperature measurement. Okay, Japan. No trade restrictions based on the information available. Well, that's kind of 1 or 2 cases in Japan. But I mean, come on, this thing was already... It doesn't say anything about restrictions on China either, actually. There's no update of whether there should be restrictions on China. Okay. Share travel history, seek medical attention, blah, blah, blah. So it's all completely voluntary, isn't it? Yeah? Public health response. Okay. Travellers are encouraged to seek medical attention. That was the same thing, same statement, just copied to and from one statement to another, 12th of January. So there's nothing really, is there? WHO risk assessment. So a city of 19 million people, they just don't think it's a problem anywhere else, basically. China shared the genetic sequence. Oh, very well done, China, right? Very well done, China. You're very, very kind. On 12th of January. Yeah, okay. Did some contact tracing. To date, investigation is still underway to assess the full extent of the outbreak. And this is where it said there are no reported cases outside Wuhan city. And that was the January the 12th one, I think. Yes, it was. They're sailing very, very close to the wind here. Absolutely, they really are. Okay. Patients have been isolated. No, there's not much about trade or travel restrictions or anything. There's nothing here about whether to test people when they come into airports or anything. No kind of advice to test people. Let's have a look at which one I've ever looked at. I don't think there's any that I haven't looked at now, actually. That's it. That's the lot, unless they've taken one off. But you can see they're the outbreaks. They're the original outbreak reports. And it really doesn't say anything much about travel restrictions, about anything. But there you go. There's a bit of a smoking gun in this paper, this new article, about there were cases in China between the 3rd and 12th of January. So why didn't the WHO say there are likely to have been cases, or there are people with pneumonia of unknown etiology and it's still being investigated? They just said no new cases. That's just really so bad. That's so negligent of them not to have said that these people had gone into hospital or were going into hospital in Shenzen. They would have known about that, unless they weren't told, in which case they should have said we weren't told, in which case they should have said be very careful because we don't yet know. The risk of virus spread increased with non-fever patients, indicating it's important to establish epidemiological history during clinical reception of the patients. This was in that paper again. So they were saying basically it's possible that asymptomatic